Hi, everybody. My name is Cecilia, and this is my presentation on HPV. The most common sexually transmitted agent worldwide is human papillomavirus, also known as HPV. There are more than 100 types of HPV subtypes. Most HPV types are harmless and can be destroyed by the body's immune system. The HPV subtypes that are at high risk for cancer are HPV variants 16 and 18. HPV alone doesn't cause cancer, but requires triggers like smoking, pregnancy, UV light, and immunosuppression. So this is an image of the human papillomavirus. It's a part of the papillomaviridae family. It is a non-enveloped double-stranded circular DNA virus with icosahedral capsids. The virus has an approximate diameter of 52 to 55 nanometers. The viral particle consists of a single double-stranded DNA molecule of about 8,000 base pairs that are bound together by cellular histones, which are used to wrap and condense the DNA, and contained in a protein capsid composed of 72 pentameric capsomeres. The double-stranded DNA molecules encode proteins that promote cell growth. HPV capsid proteins bind cellular receptors located on the basement membrane or on the surface layer of the basal layer cells. HPV enters cells by endocytosis. The HPV genome is released into the cell and transported into the nucleus for transcription and replication, where it initially remains non-integrated as an extra chromosomal part of the cell. During normal basal cell division, two daughter cells are produced. One remains in the basal layer and the other moves towards the epithelial surface, undergoing differentiation as it moves. When they reach the upper layers of the cervical epithelium, the HPV genomes are packaged into infectious variants, which are lost from the surface in desquamation, which is peeling or flaking of the cells. The incubation period for HPV is 2 to 3 months, with a range of 1 to 2 months for genital wart symptoms. It's a slow-growing cancer. It can take up to 10 years for high-risk HPV infections to develop into cancer. So HPV is a sexually transmitted disease that requires skin-to-skin contact with an infected person. Transmission is most common during vaginal, penile, and anal or oral sex. HPV can enter epithelium through microabrasions. The virus is very stable in that it can be able to survive on fomites and surfaces for days. Protection against transmissions includes getting vaccinated with yearly visits, like PAP visits, and getting vaccinated using condoms during intercourse and avoiding direct genital contact. Many people with HPV don't develop any symptoms but can still infect others through sexual contact. Most sexually active men and women will be infected with one or more types of HPV at some point in their lives, but many of them will improve from infection without any symptoms. It may take some time to develop symptoms that include warts on the genitals or surrounding skin. Genital warts are rough cauliflower-like lumps that grow on the skin. High-risk forms of HPV often don't cause symptoms until they progress to cancer. Cervical is the most common type of HPV cancer. Other types of HPV-related cancers include anal, penile, throat, vaginal, and vulvar. According to CDC 2022, based on data from a 2015 to 2019 survey, about 47,199 new HPV-associated cancers occur in the United States each year. 26,177 among women and 21,022 among men. The annual number of cervical cancer deaths on a global scale in 2022 was 341,831. The diagnosis and treatment of HPV are dependent on the level of severity. Primarily, a physician will be able to diagnose genital warts immediately. Because signs and symptoms are not normally shown, annual visits to the doctor for pap smear tests are recommended for sexually active people. Pap smear screens for cervical cancer and precancerous cells that may become cervical cancer if left untreated, since cervical cancer is almost always caused by high-risk HPV, like variants 16 and 18. So in this image, we have progression from a normal epithelial to cervical carcinoma, which can be caused by HPV variants 16 and 18. So as you can see, as the progression, it can get pretty bad, especially if left untreated. Treatments for HPV include chirosurgery, which is freezing off warts with liquid nitrogen, LEEP procedures, which is loop electrosurgical excision procedure by removing warts or abnormal cells from the cervix, laser therapy using intense light to destroy abnormal cells, and prescription creams for exterior warts. The most effective preventative solution for HPV is getting vaccinated with the HPV vaccine to prevent cancerous variants like HPV 16 and HPV 18. HPV vaccines stimulate the body to produce antibodies that, in future encounters with HPV, bind to the virus and prevent it from infecting other cells. The vaccines do not prevent other sexually transmitted diseases, and they do not treat existing HPV infections or HPV cancers. For demographics and AI, it is estimated that 80% of sexually active men and women will acquire at least one HPV infection by the age of 45. Worldwide, 12% of women, 12% of women worldwide had a detectable cervical HPV infection. HPV prevalence is higher in age groups rather than sex, with an increasing number of people less than 45. The use of artificial intelligence in healthcare is using algorithms and machine learning to improve upon pathology and screening tests for various diagnostics. In a 2020 study, the AI system was able to detect abnormal squamous cells and epithelial tissue with 94.7% accuracy for cervical cancer. The AI system was able to find more abnormal slides than cytologists using traditional methods. AI has great potential to improve the early detection of cervical cancer by looking for abnormal cells caused by HPV. These are my resources, and thank you for tuning into my presentation.